You're listening to B2B Tech Talk with Ingram Micro, the place to learn about new technology and technological advances before they become mainstream. This podcast is sponsored by Ingram Micro's Imagine Next. It's not about the destination. It's about going someplace you never thought possible. Go to imaginenext.ingrammicro.com to find out more. Let's get into it.
Welcome to B2B Tech Talk with Ingram Micro. I'm your host, Carrie Roberts, and my guest today is Chris Sullivan, the Global Healthcare Practice Lead at Zebra Technologies. Welcome to the show, Chris. Thank you for being here today.
Carrie, thank you. Really happy to be here and appreciate the opportunity to talk healthcare technology.
Yeah, so the power of healthcare technology is about making people feel healthy and secure. What do you think is working well in the healthcare technology space right now? And are there any trends that you're seeing?
So, Carrie, I feel good about the progress the global community is making with healthcare delivery, and technology is really a big part of that. We're seeing life expectancies increase. We're seeing the accuracy of healthcare improve. We're seeing the quality improve. And healthcare technology is really making a difference. So a few examples, simple example and a little bit understated, but very profound, is the power of the barcode in the healthcare setting. So as we think about our personal experiences when we shop, it is, of course, the norm to have the items scanned. That authenticates the right SKU is being purchased. It makes sure the price is matched. It also has inventory replenishment power. And we may get a little uncomfortable and freak out a little bit if there's no barcode and scanning in our retail purchasing processes. And so that's been a norm for decades in consumer purchasing. But the barcode has been slower to adopt inside a healthcare setting. And there's really a lot of momentum and growth with that. And the barcode adoptions are happening both with medications and pharmaceutical activities, but also medical device management and really many other diverse things in healthcare, such as blood and specimens and even people. So barcodes, just like in retail, are creating safety. They're creating accuracy, which creates safety. So in retail, if something's incorrect, you pay a higher price, or maybe the inventory is slightly off balance. In healthcare, if there's a task that's inaccurate, it can be life or death. So barcodes are really making a difference, and the barcode ecosystem and environment is really making a difference in the safety, the accuracy, and the efficiency of healthcare. And that's been a slow train that's been building, continuing to build, and it's really driving a lot of value and benefit. It's also a stepping stone for more advanced technology applications that can be layered on top of that. So as an example, it's now very common in many countries to see electronic health records in place and other clinical information systems in place. So now there's a enterprise-wide system of record that's able to digitally track and record the care for people, which both has productivity value and safety value as well. We see the electronic health record systems as innovation and use of technology at the center of the enterprise. And now that the barcodes and EHR systems are in place, we're now seeing a strong surge of technology adoption at the point of care. And so in AIDC community language, this is mobility and mobile devices. We at Zebra Technologies talk about our clinical mobility solution, which is bringing the power of information, the power of data that's been established in the healthcare organizations, but transitioning them away from a desktop centralized environment to the bedside, to the ambulance, to the emergency department. And that has an amplifying and accelerating value driver for technology. So lots of good things. I could talk on this topic for a long time, but those are a few examples of how technology is helping healthcare and working well today.
Yeah, that's extremely exciting. And as you were talking about, this digital industry in healthcare is quickly advancing, especially given the last few months. Can you tell us a little bit more about Zebra Technologies as a whole and how they're helping with the size and scale of the healthcare tech space as it's growing so quickly?
Yeah, so great questions. So Zebra Technologies as a whole, we've seen a very strong surge in our healthcare business. Healthcare for the last 5 years has been the fastest growing vertical industry within our company. We've invested significant resources and capabilities into our healthcare business. We now have over 350 healthcare unique products and SKUs. We also have approaching close to 100 worldwide team members who are focused on healthcare. And combined, when you add this up, it's a very effective and formidable healthcare organization. Those capabilities have been working to innovate and improve healthcare workflow for some time. But in the last few months, with the events that have been placed upon all of us, we've pivoted very quickly and created a series of custom and net new solutions. So we focused our efforts around infectious disease control solutions and also patient surge management solutions. And we're trying to help organizations handle their current state in a manner that is nimble and quick and flexible to the unique conditions. We have over 10 different solutions that we're working on right now specific to the current environment. And just a few examples that I'll provide to illustrate how the advanced technologies are being adopted. One of those is with a drive-through diagnostic testing application. So Zebra already has healthcare purposed mobile printers. We already have healthcare purpose designed mobile computers. We have healthcare labels for these workflow applications. So these mobile technologies have quickly been put to use in diagnostic testing and drive-through testing use cases, which enable contactless testing between the caregiver and the patient. What's new, though, is that we've worked with our internal and external resources to create software capabilities that enable this specific use case. So custom software that facilitates the data reading biometrically from the individual who's in the car and the parsing of the driver's license information to capture data. So we've added software capabilities to complement the already pre-existing healthcare devices that are in place. We've recently released proximity tracing applications that can help organizations track and trace which people are interacting with each other. So the ability to know who's entering what room, the ability to know which caregiver or which healthcare worker has been in contact to which other people is another example of the innovations that we've been working on. And really, as mentioned, there's quite a number, around 10 of those that have been put in place today. And what's exciting is that not only are these new solutions relevant for the current environment, but a lot of these capabilities that are built into these new solutions will have very high value post-crisis situation as we look at the new models of healthcare delivery.
Well, I congratulate you and your team because that's quite a lot of effort that you're putting forward through everything happening in general, but especially during this time. Do you have any customer success stories that you can share with us in terms of the value your company has brought to the healthcare space?
Sure. We've really had a diverse amount of wins and successes that are becoming normalized. I'll share just a few examples. One example that I like to talk about is a large health system in the Western United States, 30 hospital system, that shared with us the story that their clinical informatics leader received when she presented our mobile printing and point-of-care printing solution results. They had already implemented the results, and after implementing the Zebra solution, they went into a first in their history, 0 specimen collection errors. Traditionally, specimen collection errors are somewhat common in healthcare. They create enormous problems, and this hospital, post the Zebra solution, received 0 specimen collection errors over an extended period of time. The individual who presented this said it was the first time in her 25-year career in which she received a standing ovation within her environment. They were so happy and proud over the results. So the mobile technology around specimen collection is really a great success story and a great use case. We had a very large health system in Australia that shared with us their pre-mobile device implementation and post-mobile device implementation results. And what they quantified was about a 15% increase in the amount of time that the nurses are able to spend at the patient bedside. That's huge because it creates better patient experience. It correlates to improved care quality. It also correlates to happier nurses. When they're able to spend more time with the patient, it means that they're spending less time on administrative work, less time on manual work, and those value drivers are a direct outcome of clinical mobility implementations that automate work, that streamline processes, that make things much more patient-centric. We had a hospital in the United States share with us that they implemented our RTLS solution and had over $900,000 in savings in operating expense reduction and labor efficiencies. And so these are a few examples. We could share many more, but hopefully that gives a sample. And of course, we're happy and welcome the opportunity to have more specific conversations for those who are interested.
Real quick, before we jump straight back into the episode today, we want to tell you about Ingram Micro Financial Solutions and how you can maximize your buying power and get to yes with your customers faster. For the last 9 years, Ingram Micro has been Channel Pro's Reader's Choice for best financing options. Put the power of our credit and leasing options to work for you. You can easily contact Financial Solutions at ingrammicro.com. All right, let's get back to the show.
No, I think that's a great rundown. And, you know, your company Zebra doesn't just provide technology for the healthcare space, but the company has also helped the community. And recently they did so by donating quite a bit of money to the Red Cross and providing various free resources. Can you tell us more about this?
Yes, Carrie, thanks for bringing this up. So Zebra's had a long-term relationship with the Red Cross. This relationship started with us providing our technology to help them make blood care capture and delivery and management safer. And over years of working with them, we increasingly became a stronger advocate for the value that they provide. And it's critical to have available blood supply to administer patient care. And we have invested in this relationship with both financial donations and also with technology donations as well. Our financial donations have been in the hundreds of thousands of dollars. And we also have dedicated, as mentioned, our technology and also our time to help them in a variety of activities, including blood drive work as well. I'd like to share why this is so important. So unfortunately, only 3 out of every 100 USA citizens donate their blood. So there's just such an opportunity for all of us to do more blood donation. And in normal times, available blood inventory is scarce. It's not always adequate for all of the demand needs. And so as patients enter critical care situations, blood transfers and transfusions are often life savings. life-saving, but not always available or to the degree of availability that's desired. And recently, though, blood collection has been halted due to current situations. And so the input of new blood donations has dramatically shrunk. And so right now, caregivers are having to really ration the blood transfusion utilization. It's a very serious situation right now, and it's just such a critical issue for patient care delivery and safety. And so we just believe in the organization and have put our efforts towards supporting that, and we certainly plan to continue doing that.
Well, again, I think that's great what your company is doing. And I want to just change the focus to you as an individual, Chris, because not only is Zebra a company that cares about healthcare and tech, but you personally do as well. You're on the board for the IoT community in Chicago, and you're on the board for the Swedish Covenant House in Chicago as well. Can you tell us a little bit more about your involvement at these places and why it's important to you to be a part of your local community health and tech space as well?
Well, one of the things that we all share is the opportunity to help healthcare. So when we work and when we apply technologies and we choose to apply towards healthcare, it transitions from being a business transaction to being a people impact. All of us at some point are healthcare patients. We all have loved ones who are at the receiving end of patient care from the healthcare professionals. And so anything I can do personally to help the healthcare professionals, the frontline workers, they're the real heroes. They're the ones that tirelessly make a difference. And I just personally feel very passionate about helping healthcare professionals. So as you shared, I am a volunteer board member at a large hospital in Chicago. And in this role, we provide support and guidance to the leadership team of the hospital as a board member. And I also work with a global technology organization called the IoT community. And I lead, in a volunteer role, I lead the healthcare best practice adoption and utilization of IoT applications in healthcare. If we can help people learn where technology works best, if we can help people from having to reinvent the wheel and inadvertently repeat the same learning mistakes and growing pains that others in front of them have done, we're doing everybody a big service in that process. So those are some of the reasons why I like to give back. But of course, anytime you're giving to others, you end up receiving a lot as well. And what I find in those types of situations is that I learn a tremendous amount. I learn about the pain points of patient care delivery, the pain points of technology. Sometimes it works in unintended ways that aren't good. I learn about innovation and learn about what's really needed from the people that are on the front line. So those involvements are important to me. And I, as mentioned, get a lot out of that and feel it's a great calling for all of us to try to help those healthcare professionals.
Yeah, I think it's great. I think it's great to be a part of your community and not just in the work that you do as well. One of the questions we ask on this show all the time is, where do you see technology going within the next year? It could be if you want to speak within healthcare or as a whole.
Well, what's going on with technology in healthcare is that it does follow the larger patterns of society, but it's a trailing indicator, or it trails other industries and personal applications. So Zebra Technologies is well known as an AIDC company. We've established market lead position in a lot of the technology products that we're familiar with, such as printers and scanners and mobile computers and so on. But what is less known and understood is that Zebra is advancing far beyond these legacy technologies. And I'd like to share some of the investments we're making, because this is a indicator of where technology is going. So in the last 18 months, Zebra has made 4 acquisitions. We've acquired a smart label company that can use chemistry on the barcode label to identify temperature variants. We've acquired a company that does predictive data analytics, so we can implement next step actions around solutions that we contribute towards. We've also acquired a company that does video analytics and artificial intelligence algorithms around visualization activities to make the incorporation of not just data, but also voice and also video technologies to bring smart workflows. We've also acquired a ruggedized tablet company to, again, put more investment towards the edge or the point of care technologies. Zebra is also organically investing in robotics. We released a robot for the retail industry. We're working on hands-free technologies that incorporate augmented reality, head-mounted displays, and also natural processing language technologies. So these examples of what Zebra is doing is where's the technology going? So what we're seeing is technology move into anticipatory next step predictive elements, and we're seeing technology move towards automation of manual tasks, where machine learning, robotics, and the synergy between hardware and software components can come together to have smoother, more streamlined workflows. And that applies in all industries, I think, but certainly in healthcare as well. In healthcare, some of those advanced technologies are being looked at for real-time location solutions, also for telehealth applications, remote patient monitoring. We're starting to see a lot more technology leave the hospital and move into the community of healthcare, the community health. And we're seeing also home health as well. So we're seeing the United States and other countries transition from treating a sick person to helping someone stay healthy, preventing the illness before it happens. And this is really best done through advanced technologies and the interoperability of secure technologies for that.
Now, we spoke about a lot of great things today. If people have questions or they want to connect, where is the best place to do that?
So what we'd like to do is have Kathleen Mowry within Ingram Micro be the point of contact. And she has at her disposal a deep bench of Zebra specialists and experts that she can draw upon to help us engage with folks who want to learn more. We talked about, as you shared, so many different things, depending on where the interest is or depending on what the use case is, we have different specialists. So it's very hard to know who's the right subject matter expert on any given topic. So we'll handle those types of things offline and make our team members available through Kathleen. We also invite people to visit us on our webpage, zebra.com. We have a solution page which talks about our healthcare business to some degree. And so that's a way to get some general information. But for specific opportunities, we are available to engage. We would be happy to do that. And we'll let Kathleen facilitate that process and bring us into those discussions.
And we'll link her information in the show notes as well. Thank you so much, Chris, for not only sharing your expertise in this area, but really your passion for what you do that extends into your personal life as well. So thank you so much for being here with us today.
Thank you, Carrie, and I enjoyed it.
If you like this episode or have a question, join the discussion on Twitter at Ingram TechSol with the hashtag B2B Tech Talk. Thank you for tuning in and subscribing to B2B Tech Talk with Ingram Micro.
You've been listening to B2B Tech Talk with Ingram Micro, hosted by Carrie Roberts. This episode was sponsored by Ingram Micro's Imagine Next. B2B Tech Talk is a joint production with Sweetfish Media and Ingram Micro. Ingram Micro production handled by Laura Burton and Christine Fan. To not miss an episode, subscribe today on your favorite podcast platform.